Hello and welcome to the Nurse Rosa's Insights podcast. I'm your host, Rosa Hart, and today I am joined by two people who don't work together, but they work aligned with one another. And I think we're going to have a really cool conversation about aging in place and the technologies that we can use as people are getting older to help them be empowered to stay at home. So, first off, we have Pam Toto. She is at the University of Pittsburgh, is an occupational therapist and runs the Healthy Home Laboratory, which I can't wait for her to share more about because she kind of showed me some of that on a previous call, and I can't wait for you to hear about it. And then also we have David Eby. David is a businessman. He is big in technology and more recently has become a caregiver for his aging parents. And that has kind of brought an intersection of his knowledge and his expertise in business and in fire safety into how do we protect people from those types of dangers at home and how do we use technology to do that. And so you can probably tell the alignment already, but I'm really excited to get to hear from both of you more as to what has really been your motivation and what's driving you forward and hear your answers to the billion-dollar question here shortly. Pam, before we get into those big picture questions, could you share some of your backstory in healthcare and how you became so passionate about aging in place?
Sure. Thanks, Rosa. So I have always had an interest in working with older adults, I think partly shaped by my upbringing and having a really strong family ties with strong aging adults in my life. I wanted to go into healthcare. And I wasn't familiar with occupational therapy. It became made aware to me while I was already in college. And I just thought it was a perfect match for my skills because I really wanted to help older adults to be able to remain independent and safe. So it was a nice alignment. And I had a really great clinical career and really intended to stay in clinical practice for my career. But I was frustrated by the gaps between really good solutions that work for people to be more independent and safe and the lack of using those solutions in the real world. So I felt like if I kept working with one client at a time, I would retire with still a lot of work to do. So that really transformed my trajectory. I went on to school to get my PhD and to really transition into education and research. And so now I have a great opportunity to be able to run this lab that I'll tell you more about, the Healthy Home Laboratory, where we really are focusing on trying to implement some of these really awesome practical solutions that keep people both independent and safe.
And it is such an exciting research lab that you have there. And David, share with us some more about your background and what's informed your perspective on this.
So my background's in technology. I won't go too far back because that's like DOS days and Windows 3.1. So I'll skip really far ahead here and just look at the last sort of 6 years. And so I've got involved with a business initially out of Virginia that was doing some fire suppression, and I was really interested and got into it. We got a lot of attention and really thought this was a great sort of category that was a new category. In an old category because fire suppression and putting out fires is a very old technology with sprinklers and fire smoke detectors and all that kind of stuff. And so when I entered into this business, we got it off the ground selling it, but it just wasn't enough. It wasn't something that was really, I put out a fire, but it wasn't connected, it wasn't scalable, and it wasn't low cost. So how do I utilize my background in sort of software and machine learning? And we have a fantastic team that we have on board. And we were sort of put to the test of at machine learning level, can we create a software that will predict an unsafe situation rather than react? And so this is the big thing that we did. And so this is all the background stuff as well, where so I politely exited out of the other business in which we've helped them with engineering and stuff, and they're selling product. That's great. But we spent about a year collecting data. So we work with a university and the sort of machine learning computer science department to bring a lot of students in we had 6 test kitchens and we had to build out our data set. And it was really kind of cool because we didn't know what we were doing, and we couldn't buy the data set because it was not available. So you get it for trucks and cars and motorcycles, but not for cooking. And I thought that's really kind of interesting because cooking is just every
Right.
day.
It's so fundamental. Everybody has to eat. What are they doing?
Like, yeah.
Not suppressing their fire.
DoorDash.
Obviously. Yeah, DoorDash.
That's right. Yeah, it's a DoorDash. Forget about the machine learning.
Well, I mean,
But
besides dryer fires, are kitchens like the source of most fires in the home?
Well, I mean, this is what sort of as a technology person, well, why are we not attacking this problem? Because cooking is the leading cause of all residential fires.
It is. It's not dryers.
It's not dryers. It's not smoking, and it's not electrical. Which was with National Fire Prevention data. It shows that it's not going down. It's actually more injuries are happening. And what I see in the data is that it's because we have more people aging in place, and so now you have more people that are having injuries while cooking. And so this is still happening. Forget about my 21-year-old at university leaving the stove on or trying to heat a pizza box in the oven, which, this is, this is, so this is sort of
16-year-old. That scared me.
Yeah. So, I mean, these are all things we can relate to, right? So I guess the idea was that using the data from the National Fire Prevention Association, it'll tell you how many times a dog jumped up and turned the burner on. Like, it's great data.
You told me about that. I was like, how is that even possible? But there's a video of it. These dogs turning on the stove.
is not the biggest issue, but it's still a data point. The other thing that sort of astounded me with the data was that data is only collected when they roll the fire trucks. This is not any close call data. So there's only one study done by the Product Safety Commission, and what it showed was 87% of fires don't get reported. So how many close calls are out there? And nobody's collecting this data while people are moving through their life and cooking. And so this was this whole idea of how do we look at cooking behavior? How do we sort of use software to sort of detect this behavior before it happens? No different than somebody working on fall detection. So I talked to another company a couple of days ago. They go, I could detect 75% of fall within 4 days. I'm like, I don't know how you do that, but that sounds fascinating to me. And so we're kind of doing the same thing with cooking fires because of cooking fires being the leading cause, and because we have this whole emerging market into aging in place where so many people are going into these areas and having challenges. So that's sort of how we sort of implemented how I got into it. We developed the software. We're just started shipping about 6 months ago, and we have this product that predicts and detects an unsafe cooking situation before it happens and alerts and does it all automatically. So I could go on for hours, so I'll stop talking.
Well, you're obviously very passionate about it and you wanted to talk about it. I think you said you had an incident with your dad, right?
Yes, back to my dad. Thank you. Appreciate that. So
was your dad your guinea pig?
My mom and my dad were part of being a guinea pig because they were so excited to see this, because they were really, my mom is very active. She plays bridge. She goes away for 4 hours with her girlfriends and nobody can bug her. And then my dad struggles with diabetes. And so he has these lows and he doesn't know when the lows are happening. When we put the device in, it was great because it would give my mom some peace of mind that and he still likes to cook. Like he just loves to cook in a frying pan. And then he likes to read the newspaper, spread it all over the kitchen. Part of it's on the stove. So you're just looking at a problem about to happen. So this really helped them. But back to your question, is that what we were able to do is catch him at 2:30 in the morning cooking. And when we talked to him, so I called my mom at 2:30 in the morning. I go, Dad's cooking. Like the thing's going off. And so she said, no, he's not. I go, okay, whatever. So she goes out there. He has no recollection of cooking at 2:30 in the morning. So where do we go next? So this was our first piece. Like, this is me seeing dementia live. And so where we went with that was then we went and he had a test, and sure enough, he had some cognitive decline. But now we started paying attention to this, and he kept doing this. And so now we were able to keep him safe. And then with my mom, knowing that this is going on, to pay a little bit more attention. So it gave her a bit of a heads up. And so, because it wasn't going to get any better. So how do we manage this? And so it actually triggered caregiver coming in sort of every other day and then every day and all that kind of progress. I think it's not just our technology, it's so much technology coming into the space that's going to help. And I think that's what I've seen with other companies doing technology. I must
Yeah.
have talked to 20 or 30 fall detection companies.
Yeah, and I just recently visited this place called the Thrive Center here in
Hmm.
Louisville, Kentucky, and they showcase a whole lot of different things. They had me sit in a chair that's like an easy chair, but it had speakers in it, and it also like vibrated. So for people who are struggling with like hearing loss, they can hear better without blasting the TV all over the house for everybody,
Right.
but like all of the sound and vibrations like help them hear it better just sitting in that chair. So there's so many different technologies that are being developed. Pam, what are some of the technologies you guys are playing with in your lab?
Well, I think that's a fun question, Rosa, and I think that having David and I together on your podcast is a great compliment. I'm not a technology expert, although I'm learning it by necessity.
Yeah.
I'm an aging in place expert. Really, my first go-to is if I could solve the problem without technology, I'm going to solve it, but I can't. And so we've really been looking at a lot of technology in our lab. Our lab, unlike the Thrive, which is a marvelous place, we're a real house. So we actually keep the house real to show the real problems of taking this technology and implementing it. Maybe the ceiling's too high or the walls are too thick for the technology to go through from room to room. So in our lab, we've tried a lot of different products. Some of them work better than others. We try to do a lot of routines, and we focus on things that are either active or passive to the environment that makes it more friendly. So one area, just to give an example, is we've really had a lot of success with lighting. So we know that everyone as we age needs more light. It's just a normal part of aging. Our eyes change, we have age-related changes, but people might not turn on lights because it's too much effort to turn the lights off. They have to walk across the room, or they maybe don't remember to turn a light on or off, or they think that the environment's too familiar. So we have a lot of different technologies that kind of help with routines and habits, some smart lighting, even some sensor-based lighting. So let's say, David gave an example of a cognitive impairment. Someone might not remember to turn a light on or off. We could actually install a sensor where when they close the door, the lights go off at the end of the day. And when they open the door, the light automatically comes on. So that's just one example, one area that we've been kind of not playing around with, but really figuring out how to package it and implement it in ways that are reasonable, cost effective, and attractive to people, that doesn't really like make their house look handicapped or different, or so it's still a very natural way to be able to help people use their homes more effectively. To go on the lighting aspect, just to give another example, we have some smart blinds in our home, or maybe they pair on with an Amazon Alexa, or so that you can say, Alexa, good morning, I want to open up the blinds in the bedroom. But we also had consumers who came in and said, look, we live in rental housing and we're not allowed to change the blinds. So what could you do for us? So we also were able to find some technologies that can be retrofit to blinds, because otherwise that older adult's going to live in the dark all day long because they're not going to go around their home and open and close 16 blinds every single day. So that's just one example. We're really trying to match what the consumers are telling us that that they're interested in, what's important to them. And then obviously always starting with the simplest, the least expensive solution if we have one. We can ramp up, but coming up with a really good product, but that less than 1% of the population can afford, doesn't really make a lot of sense. And so I like what David was saying about his products being cost effective as well. Like, so we're trying to keep people doing things for themselves, not just living in their home, but keep them cooking, keep them independent, but it has to be a reasonably economical that makes sense for family members and for older adults.
So true. And David, I'm loving that your parents were so receptive to having that sensor and trying it out, because I feel like there are a lot of people who are like, I don't want somebody watching me or things like that. So do you feel like the way that your sensor is set up is pretty unobtrusive so that people don't feel like they're in safe house and being watched all day?
Well, I mean, I with my parents originally, my mom would actually leave for go on these trips, bridge trips with her friends, and then we would
That's
put
true.
my brother and I would put video cameras around their apartment, and my
Oh, so
dad
just while
hated it.
she was gone,
Just so we could watch my dad because it was either
and you take
that
them down when she comes back?
and then yeah, then they come down when no, but this is how we sort of started, right? And
Okay.
so this was not and to see my dad walking around and doing his things, it's not really helpful and he didn't like it. My mom didn't really like it, but it gave her a bit of peace of mind because he didn't want to come and stay at my brother's house or my house, right? So he's like, "No,
Gotcha.
no, I'm fine. I want to be here, and I want my papers and my, I love everybody's, cooking, but I don't, So that's sort of what happened there. But I think that what I did find out early on was I knew that seniors didn't like to have wearables or video cameras. So when we did our initial studies, we said, okay, so for us to do what we do through an actual camera is very easy. I mean, we could actually create some more features if it was a video camera, but we didn't want to use a video camera. And so we chose the thermal sensor. And what we did before we really got into that technology was we went and did a study group where we showed, do you know what a thermal image is? Most, like 98% said yes. And then we said, okay, here's a picture of three people. All right, now here's the picture of the three people in a thermal image. Can you tell who is who? And they could not. So then we took another picture. Somebody was
And
wearing
then they have
glasses.
plausible deniability.
That's right. So we just thought this was sort of the best way to help manage. And that was something that we dove deep into to use the thermal sensor and really finding out that we could do a lot of things with the thermal sensor. And yeah, so that was very important to us because we work with some of the largest appliance manufacturers and they love using cameras. And I just said, you cannot, like the senior community is not going to touch that with a 10-foot pole. So, it's fine if you want to show you've got an avocado, you put it in the fridge and now you have one avocado and you put another one in, now you have two. That's great. But for them, the senior, I always look at the senior as a very hard customer. Like you really have to spend the time, like we made the button bigger. Our device talks to you, so it tells you what's happening. So if you, find yourself in a situation, it'll say back left burner's too hot or danger. So that it's not just this device that's yelling and screaming at you. So there's that opportunity to correct the situation. I think what you said and what Pam said is that we're really trying to make a device that stays in the background that lets people cook. And it's just sort of say, okay, come on back and sort your situation out. Or if you're unattended, it'll tell you to come back. And, so not everybody's out front, at 8 o'clock at night in their robes and the fire trucks, right? So the idea is to really sort of get people back. And that's where national fire prevention data that out of the cooking fire is the unattended and distracted. So that's where our sensor really shines, is in those kind of situations, or an exposed burner. Somebody's accident just left the burner on. So our technology is the only technology in the world that can see an exposed burner. So
That
you can
is
see
really cool.
you can see an exposed burner, but then you have to be able to take a frying pan, take it on and off, and have it know which is which.
And I like how it really narrows into like, what is the problem area that we're trying to address? And it's really hyper specific. Like I do know that there was a woman who, her mom had a stroke. And so after that, she needed to help monitor her medications, make sure she was taking them every day, but also see like which ones she was taking, right? And like what colors and things that were in there. And she couldn't be there every day. So, and her mom was resistant to having all the cameras throughout the house, obviously, like you were saying. But she did get her to agree to having one camera that looked down at the area where her med box was so that it could clearly see like, and she would show her the medications when she was like opening them up to take them every day.
You,
Like, I'm taking this many and these are the colors of the
you,
pills that I'm taking. That way she was
you
reassured that she's not taking too much or too little of something that would be dangerous. So
Rosa, one of the things that you said and that David said that resonates with me and will influence my billion-dollar question answer, is that in general, we're really an ageist society. We're waiting for someone not to be able to stay in their home, not to be able to continue to do the things that they want to do. And that's true. It's just a fact. I mean, in the United States, we're obsessed with youth still. And so and people like privacy, and they don't want to reveal because they think that someone's going to TikTok, tell them when they can't cook anymore or they can't stay in their home because your friend's mom can't take their medication anymore. And so we frame things as being very punitive. So why would people want to reveal? And so a lot of the work that we do at the Healthy Home Lab and in my career, I'm a positive attitude. I can't promise that someone can stay independent and safe, but all my life, I've told my clients, I'm the best chance you have. Like, I'm your champion. Like,
Yeah.
I'm going to come up with every solution I can that's going to keep you doing what you can do with some level of risk that you may that you may deem acceptable. That's another tricky subject, like what if someone's care partner thinks versus them. But I mean, I think that, you know, it sounds like, even in your friend's case, like, yeah, someone might accept a camera in a limited circumstance if it lets them still stay in their home. And if they believe that someone's really trying to help them, not to punish them or to say, no, 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 you can't live anymore. But yes, 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 you can stay in your home. And so that's really the approach that, as a director of our lab, that's the approach we take, like that. And we kind of are very transparent about it. Like we are trying to keep people independent and safe and simultaneously, hopefully, reducing or minimizing care partners and caregivers' burden. It can be done with some of the technologies, like even the technology that David's describing.
Yeah, exactly. So, well, this brings us to the $1 billion question. So, I'll come back to David and ask you, if you were given a grant for $1 billion to meet a need that you see in healthcare, how would you like to see it used strategically to have the most sustainable impact?
So for me, I would say, um, I would say that it's about aging well or thriving in place. I just think that it's a great chapter of somebody's life that that technology can assist that wasn't, 10 years ago. And I think that's where I've talked to this with some of my friends that at different universities, and it's really about how do we look at this as an overall new market space, or how do we look at, there's so many different things that I've seen that can help. I've really, great, EKG sensors that can detect, stroke that's about to come. I mean, these are fantastic things. And I think that, we need to push that from, that 85 to 90 or 95, kind of area, where I think that, because a lot of people want to live at home. And I think that's the big thing. Like my parents, they don't want to go into a home. And this is I mean, we have a chart on our website that shows just 6 months of not being in a home. If cooking is an issue or fall is an issue, I mean, that's $27,000 in savings in 6 months. Now, if I said, okay, $27,000 or our sensor at $399, I mean, it's a no brainer, right? So if that's the challenge, or if it's fall, or if it's, leaving the property. I mean, that's the other thing. I mean, my dad, he came over in at Christmas for a bit, and I found him standing in a corner thinking that that was something, because you just got disoriented. So these are the things. I mean, this is that to me, it's how do we support them, and how do we support the caregiver? I know I'm going on here, but to me, the caregiver is that needs so much support. And I just think it's going to come and smack us right in our face. And I think it's like a something that's coming. And I think that we have to pay attention to our caregivers. We have to give them the resources to work with more people, less time. And how do we help them with these technologies to create a half decent workspace, and be able to deliver great value to their clients?
Yeah, unpaid caregivers are a huge workforce within our country and obviously the world, but for our conversation, our country. And so I think you're right that investing in ways to support their caregivers is going to be crucial to helping people stay at home. And I mean, they show that if you are caring, or if you're a caregiver, then your risk of dementia really goes up with all that stress that it puts on you. So, definitely providing more support as we have been less communal as a society and don't have intergenerations like living in the same household to help each other out with things. We've If we're not going to do that, then we need other options, don't we? So, Well, then, Pam, I'm going to turn it to you. So, if you were given a grant for $1 billion, how would you meet the needs you see in healthcare?
So, Rosa, when you first told us this question ahead of time, I think I didn't really realize how much $1 billion is. So I had to look it up a little more today, and it's a lot more money than my brain can even wrap around. It's a lot of money. So so, when I think about this, and it's something David said, I've been an occupational therapist for over 30 years. And what's ironic to me is we still address aging in the same way we did 30 years ago. When an older adult starts to decline, we today, with all the technology that we have and in permeating every aspect of our life, we have better solutions than sending someone to a nursing home, moving them to their daughter's house. It's always the daughter. David, I knew we'd talk about your parents. It's always the daughter. Or
Probably the eldest
right,
daughter, but
exactly. Or putting grandma in the dining room corner with a hospital bed, a bedside commode, and bubble wrapping her. There are better solutions. They are out there. They already exist. We've been hearing about David's product, which is just one of them. And so I think if I had $1 billion, those solutions exist. There are exercise programs that make people stronger, but a lot of people don't like to exercise. There's environmental modifications that grab bars or improve lighting or even increasing the height of someone's bed that makes it easier for them to get in and out. They don't even have to learn to get in and out. It's just a higher bed. Or
or the SedMed toilet. You've seen that.
exactly. Or technologies that let people keep doing the things that they want and need and are expected to do, like cook, okay, or like being able to get a shower by yourself instead of someone bathing you, if we can just give you a shower chair. So with my $1 billion, I would take, let's just say half, but I'm not sure. I don't know the pie. I would take half of that money and purchasing, make these technologies, and some of them high tech, low tech, free and available for people. Give them away where they're not just willy nilly getting those, but getting like them in a thoughtful way, getting them installed, getting them support, and teaching them how to use it. With the other half of the money, based on my research, is even if we did that, people still wouldn't take it. Okay, because we need to change behavior and culture, and that's probably harder than giving the technologies. So as a researcher, I'm an expert in older adults in aging in place, but I'm also an expert in implementation and knowledge translation. And I know that change is hard. And so I think that we would need to have more of a thoughtful way of changing people's attitudes and wanting to do this. So I would take the other half of my money and develop an incentive program, because people, if they're incentivized, not just giving them the technology, but other things. I was trying this out ahead of time with my husband. He's like, that could be a slippery slope. I'm like, I don't have to explain the slippery slope. I just have to figure out how to spend the money. But, you
Also,
know,
slippery slope is a fallacy.
I know, I agree. So I didn't want to argue with him, but I just let him have his way.
Absolutely.
So, we could incentivize individuals or organizations or regions. So the early adopters, the people who embrace this, we know from science that what you do is when you're innovative, you embrace the early adopters and you show the rest of the world that it's working and you incentivize them. And what that does is that creates momentum, right? For people who are the early majority who say, hey, Rosa did it. Maybe we can do it in our community too. And then what happens is I run out of money, but now I have 50% of the country or the universe or the world or wherever we're targeting doing something a better way. Instead of thinking of why grandma can't stay in her home, how can grandma stay in her home with these pieces of technology? And then if we can measure the right outcomes, that we are showing that it's 27, like we're saving money, right? That all the people who are interested in this, the caregivers having less burden, the health plan spending less money, the government is not doling out $68,000 a year for someone to be in a nursing home, which, by the way, is not where they want to live. Then we can reallocate those resources to be able to give another billion to do the other half.
That's
That's my small task. So I think that's what I would do with $1 billion. And I want to just talk about incentivize. I was thinking about myself when I was preparing for today, and I was thinking about how I answer a health questionnaire every year with my health insurance because they give me 50 or $75 to my health savings account. Like that's incentivizing enough for me to answer a few questions. Or my mother-in-law who is in love with a food card or a gas card, and that's how she chooses, a Medicare Advantage plan that she's going to select each year. What incentives are they going to give? So oftentimes as a society we punish people, but if we could turn this around and say we're giving people things, we're acknowledging that people can learn. And I want to give an endorsement again. It's to David, like we're going to be best friends after this, but Older adults can use technology when it's meaningful to them and if they want to. We don't want to shove it down their throats. If they're not ready, we can explain it to them. It's how we frame it. So I go
Yeah.
back to your example, Rosa. Mom, I want you to stay in your home, okay? But you keep forgetting to take your pills. I can't be there every day. Let's come up with some solutions. The solution that you're going to just do it on your own doesn't work. And I'm willing to be your champion, but like we've got to come up with something. I know you don't like this, but here's A, B, or C. What do you want to try first? So I think that attitude really can go a long way. We're all aging.
And it's
We're all
collaborative,
aging.
right?
Yes.
We don't
Yes.
none of us wanna be really alone, even if
Right.
we want privacy, that
Right.
doesn't.
Right. So that's my $1 billion. I think I can do that with $1 billion, by the way.
Think you
Yeah.
could. I think
So
you could. Like, honestly, it can go a long way. And my point with this question is to emphasize if making a sustainable impact, or like you guys were saying, like if we demonstrate that this is effective and let people know about it enough, then even after it gets established, it will have that momentum and that
right.
inertia to keep
Right.
going, and it will have a demand to be used, right?
Yeah, just to
So,
add to that too, because I think that's one of our challenges is that this category is not well represented in telling everybody that these products are available. So, even my mother and her friends were going to put together a flyer just on sort of, where do you go for this, that, and the other thing. So, and that's sort of what we're seeing, that I'm seeing just in my category with other products that are maybe like products that we do, is nobody's done a great job communicating out to the senior community. And how do we do that? It's the same thing when I work with our product integrates into different platforms. So a notice, an alert can come across the TV and all sorts of different things. But now the platforms are like the Wild West. Which one's going to work? Which one's going to be the one, right? And it's so how do we get behind this to get in front of my mom and dad and say, by the way, I think this is going to be really helpful for you, and sort of prove it out. And that's why I say earlier that, I mean, my parents are tough customers. Like you really have to, it's not coming. Well, first off, it's a no. Right. And so to your pen,
Right.
what you were
Yeah.
saying is, and I always say to my kids, look, I'll always try to say yes. I won't come out and say no. Right. So how do we create a lot of yeses to like my dad's not going to be taken down by the vacuum cleaner. So, but he could definitely be taken down by the stove. So
Right.
how do we,
Right.
and so how do we manage that? How do we manage, the locking system on a door
Right.
so that he doesn't go wandering down the hall and then my mom gets upset? So I think this is, and to your point, Rosa, is that everybody can't afford to be in a home. Like this is not a reality for most. And so who is paying for this? The government's not going to pay for it. So how can we utilize some technologies to have people have, that those last years or months in their home and having a normal kind of
Right.
life?
One other thing I want to just pitch on, and I think for me, it's been really easy. David, your product's a cooking product, and this is just one, we call them occupations as an occupational therapist, or an activity of daily living, or an instrumental activity of daily living. But as humans, there's inherent value for us having purpose and being active, using our brains, using our bodies. It raises our metabolic rate. It makes our blood, it moves blood through our systems. It makes our synapses happen in our brain. I mean, if you read all the literature, being engaged is healthy. And I think historically, when people start having difficulty with their daily activities, what we've always done is we eliminate the problem by removing the activity. Someone else does cooking. Someone else bathes you. Someone else does your laundry. You don't go grocery shopping anymore. And certainly there's reasons for that. People aren't just being malicious and saying, Mom, you're never going grocery shopping again. But being able to do that keeps people active. And so if I'm preparing a meal, yes, and maybe I'm a little tired after I prepare the meal, but it also helps me get a better night's sleep. Right. Which then, or if you find an easier way for me to be able to continue to do it, or I like my food better, now I'm getting better nutrition because I'm eating the food the way I want it, as opposed to a meal that you brought in that I don't really like, and then I don't eat. And by the way, I'm just sitting around doing nothing all day, and then I'm not tired and I get a bad night's sleep. So, our lab isn't, I didn't really say this, but I really do want to emphasize this. We're an interprofessional team. So we have occupational therapists, we have nurses, we have engineers, we have people from emergency medicine, we have physicians, we have social workers, we have people from the graduate school public health, we have people from dietetics and nutrition. And really, all these pieces, it's whole health. I think David's kind of said this at the beginning. It's about well-being and living your best life. And all the pieces connect. It's not individual. I mean, it's like a Rubik's Cube. I mean, it all connects. And so I think if we could stop trying to solve individual pieces and be able to look at more of a holistic approach and bring everybody's talents in together. I'm not an expert in medication management. I rely on my physician colleagues and my nurse colleagues. I know how someone can open a pill box, but I don't know what the pills are for. I know, but I don't know,
Yeah.
but I can also, I know every piece of adaptive equipment on the market, Rosa. So if you're the nurse and you're this client's having difficulty and they're saying they're afraid to bathe, you're not calling an aid in, you refer me, just like I refer to you. And so I think, there's a lot of overlap in our roles, but we also have just some real areas of expertise and working better together with the goal of keeping someone doing for themselves or even doing with. So someone has a cognitive impairment. David, you talked about your dad, but your dad still being able to participate in cooking, even if like you had to be there or your mom had to be there, is still helpful to his well-being.
Percent. Yeah. I mean, I think
Part of his quality of life.
Yes. Right. It
totally.
also keeps him engaged. It gives him memory, even if, a backdrop for reminiscence. It makes someone feel proud and valuable. It gives people meaning and purpose. It gives organization to your day, right? Like I think about in nursing homes, and I worked in skilled nursing facilities for a long time and I enjoyed it. But, they'd always have us ask what the date was. And I thought, well, when you're on vacation, when I'm on vacation, I don't know the date. And sometimes I don't know the day of the week. So if I lived in a nursing home where every day is kind of the same, why would I know the date? And what,
So
right?
hot.
Anyway, sorry.
No, I mean, I think that having people remain in their home there is, to me, I would say, I'm not a clinician, but clinically better than having
Right.
them. So my mother-in-law had to go to a home and she wanted to have a stove, so she wanted to cook. And they wouldn't give that to her. They said, "No, you got the microwave and a bar fridge, and we have a restaurant, and you can go down." And that's part of the. And she didn't like the restaurant. So,
Right.
I mean, it was just this whole thing
Yeah.
of it's a dignity thing that was taken from her because she had some challenges, and we had a caregiver for her that ended up having to unplug the stove, which is very common for caregivers. If there's an issue, that they'll just unplug the stove or flip the breaker on the panel. And that was one of the things that we wanted to do, is be able to have a scheduler so you could turn it on
Mhm.
and off only from
Right.
6 till 8 or
Right.
whatever you want to do. You can, and
Like I
so
do with my kid's iPhone.
Exactly.
yeah, I know we needed
Exactly.
that.
Well, you just create safer. So what we do with, and it's in my opinion a real miss to compare as we age to when we're children. But we don't ever limit. What we do is we set up a safer environment. We still let our when we're growing up, we still have the opportunity to explore and grow.
Yes.
And so, but we're much less likely to do that when we're getting older, instead of limiting the universe, which is what David just described, and still letting someone be able to cook. They're not going to get up at 3 o'clock in the morning and turn the stove on. We just automatically give up the task. And that's just a shame, because, why are we living long? Like, we're living long to be engaged and have full, meaningful lives. And, I want to do the things that I love to do for the rest of my life.
And living longer. So these are
Yes.
things that we really need to look at. So if
Right.
we push it out another 3 to 5 years, well, that's another 3 to 5 years that these technologies
Right.
have to last,
Yes.
or these
Right.
processes, or,
Right.
you know,
It's true. Well, you're both building a better quality of life for people as they're
Yes.
aging so they can stay at home. And so thank you both so much for the work that you are doing. And I can't wait to see it become more endemic and
Me
everywhere.
too. With my $1 billion grant.
that's
Hello,
right.
hello, podcasters out there. Anyone has $1 billion? I have it all written down.
You got a big
Well,
scope of
and
work.
this population we're talking about, they love watching YouTube. So maybe they'll hear about stuff here and be like, I want to come try some of this.
Everyone's welcome.
You know, it's true. All right. So, Pam, if someone's listening to this and they want to see the Healthy Home Lab or get involved, where is the best way for them to connect with you?
Just Google search us, Healthy Home Lab. We have our own website. We have a couple videos that you can actually see the home and hear the history. It's a good story. It's a house that a family owned for over 100 years. And our university, quite frankly, wanted to buy it to tear it down, to build student housing. And they held out. If you've ever seen the movie Up by Disney,
Yeah.
we're
Yeah.
kind of like the Up House. The family held out long enough. The university built housing around it. And the family, when it went, they were more delighted to sell it to allow us to be able to do this work. And I'm trying to immortalize it so no one ever wants to tear it down. But so you can look us up on our website. You can send an email. We're on the University of Pittsburgh main campus in Pittsburgh, Pennsylvania, the United States. And anyone's welcome to come and see our technologies, to see. And again, we're not a smart house. We are a real house with all the challenges. And maybe we have something that looks like a stripper pole. I'm not going to say what it really is, but just to incentivize all of you. It's a piece of technology. That's all I'm going to say.
To incentivize people to come visit.
Mm-hmm.
Now, Pam, if somebody wants to give you $1 billion grant, do they need to find you on LinkedIn?
They can find me on LinkedIn. Oh, I think I just swore. If they want to give me $1 billion grant, I will come and I'll come and clean their house. So no, they can find me. Again, Pam Toto. I'm on LinkedIn. Happy to talk to anyone. We collaborate. We are not just a university specific. We collaborate with anyone who wants to collaborate. This is our mission and our goal. And I think it does take a village, and it's going to take a momentum shift, and it's going to take all of us who are early adopters and innovators to be able to kind of change the tide. And I think there's nothing better to invest in, because you can deny it, but if you live long enough and you're lucky and blessed enough to live long enough, you're going to be the one that's in those shoes. So like, you're investing in yourself. That's what I like to tell people.
So true. And David, if someone wants to connect with you about cooktop safety or anything else, is LinkedIn the way to go?
Yeah. So LinkedIn. So I'm there, David Eby, or you can go to the Cooktop Safety LinkedIn and connect me through there. Happy to talk. And as Pam said, collaborate. We love to collaborate. We are almost every day I do some collaboration with different companies. So trying to find sort of opportunities there. Or the other great resource is our website. So we've got some, what the product works for, and that's at www.cooktopsafety.com, and a little plug for the fact that it's a US made product. So it's all here, and we're
Nice.
happy that we're doing it that way. So yeah, cooktopsafety.com we've got some great information and resources and how to get a hold of us, and through email and toll-free numbers.
Perfect. And I will have all those links in the show notes as well, so that people don't even have to type if they don't want to. They can just scroll down there and tap. So thank you both again for joining me on the Nurse Rosa's Insights podcast. Thank you to our listeners for joining us today. If you enjoyed this, please like and subscribe wherever you are listening, or if you are watching on YouTube. And leave us a comment if you learned something, or if you know of another cool tool that can help people age in place. And feel free to reach out to me as well on LinkedIn or on any other social media platform at Nurse Rosa Speaks. And I'll see you in the next episode.